Good morning to you, Tonya. Thank you so much for taking time out with me today. Before we jump into our kind of conversation, it'd be great if you could just tell us a bit about who you are so we could, get the listeners familiar with you.
Hi, good morning. Lovely to be here, Belinda. My name is Tonya, and I'm the clinical pharmacist for Diabetes Consults, working in line with Medway Practice Alliance, the MPA, which is a primary care network, and we deliver several services on behalf of the NHS.
Right. And so you guys have been offering the Make Every Contact Count. I want to make sure I get that name right. The MECC, along with COVID-19 vaccinations on behalf of Primary Care Network. What is MECC? What does it entail? And how long has it been going on?
Right, we call it MEC. It's been going on officially since January of 2023. We started in the middle of January. And it's a service where we patients hop on the bus and get their blood pressure checked. They have a random glucose test done. They have information about smoking cessation, and if they've not had any COVID vaccination, they also have their COVID vaccination and they're eligible on the bus. We also do their weight height to calculate their body mass index. And then obviously say to them if they're overweight, we give them information. And there are other signposting things that we do, so like cancer awareness on the bus. So the Making Every Contact Count actually just reaches out to where health inequalities are, to reach out to the community to let them know that we're actually here to provide this service. And like I said at the start, we're working with primary care networks to be able to deliver this particular service.
So, Tony, could I just ask you to maybe share an example or maybe a story of where you really helped someone out? Maybe they didn't know that they had a particular issue and you guys were able to identify and get them help immediately?
Yeah, we do have quite a few, but I'm going to give an example of one. Recently, we had a lady come on the bus because she was shopping in the area with her son, and she didn't feel too well, but she just thought, you know what, I'll jump on the bus and just find out what my blood pressure is. Her blood pressure was extremely elevated. The top value, which we call systolic, was above 200, and the bottom value, which we call diastolic, was above 100. But the nurse that actually saw her on that day noticed that she wasn't just right. So she checked her pulse. We noticed that her pulse was irregular. She wasn't really on any medication at all. And she felt really dizzy. They did other checks on her. They went above and beyond to do other checks on her and referred her straight to the hospital. She did come back a couple of weeks ago to say thank you because she's now about to have cardiac surgery. And she was told that if she was not picked up on the bus, she possibly would not be here 6 months down the line. So these are the interventions that we're making, and there are many, many more of them that we're actually finding. People think that they're normal and they don't have any problem. They just feel a little bit dizzy or they just don't feel right and they think it will pass. They're coming on the bus and we are noticing, no, there's something not right, and we refer them on to the relevant places that they need to go. So we're making changes to the lives of people, knowingly or unknowingly, and making a difference to the community where we are.
Wow, what a story. That's like a life-saving story. If you're in the Kent and Medway area, especially if you haven't been checked out recently, there's no harm. Jump on the bus, get checked out. Do people have to make appointments or could they just see the bus and think, do you know what? I need to get myself checked out. Just hop on. How does that work?
No appointments needed. They see the bus and they hop on. They might not hop on straight away because there might be a little bit of a queue, but there is a queue control. And they get on the bus, get the blood pressure done. The nurses, we have a team of nurses, clinical pharmacists, healthcare assistants, vaccinators that are working on the team. To be able to provide the service, we check their blood pressure. If they, for example, have a family history of diabetes, we would do a random glucose test, and then we would say, based on what the results are, you need to go to your GP, or there's a little bit more emergency, or we need to watch you. So they get advice. They don't need to make any appointments to be able to come in.
And they get the results straight away in terms of the glucose test and things like that?
Yeah, so what we do is not a blood test. We do a random finger prick test, and it tells you if your levels are high. The nurse will speak to you. Have you had something to eat? Not eating, and it's mainly targeted at people who do not already have a diagnosis of diabetes. So, for example, you have a family history you don't know. In terms of the blood pressure, yes, we do tell you your blood pressure is, for example, 120 over 50 or 180 over 100. And we say, okay, it's normal, or it's a little bit raised, or it's extremely raised, and we need to do something about it. But those conversations, and patients actually know exactly what's happening with them at the time that they're being seen by the clinical team.
And what kind of patients have you been having? Is it people who've maybe been at home, had some concerns and thought, okay, there's a bus, let me jump on, or just random people walking by and thinking, here's an opportunity for me to get myself checked out?
We normally see people above the age of 18. I need to drop it there. And we have people randomly, people on their lunch breaks. They don't even know the bus exists, and they've gone into, because we're mainly around supermarkets or the high street. They've been shopping on the high street, and they go, "Oh, what's this?" Because if you see the bus on the website, or the actual bus has got NHS on it, and it's got the services, so it attracts people's attention because it's a double-decker bus. You can't miss it. So people actually on their lunch breaks, maybe they're out with friends, or maybe they're targeted. They actually say, you know what, I've seen it in the news, or I've heard about it, and I'll just Google to know where exactly they are. And then they come on the bus, and we see them.
Oh, brilliant. So right now there's a particular focus around the Kent and Medway area. Is there any reason for that?
It's an initiative by the Kenton Medway ICB, which is the Integrated Care Body, and they actually, it's an initiative that they've taken. So obviously it's Kenton Medway. So the NHS has different ICB services, ICB areas. So Kenton Medway have taken the initiative to be able to deliver this for the people within their community. Hence, we're focusing around Kenton Medway.
And are there any plans for any other areas that we could be looking at for the busing, or is the just Kent and Medway the focus at the moment?
It depends on other ICBs, so I can't speak for the other ICBs, but I know that the bus has the awareness of the bus and what the services that the bus is doing has actually just opened the eyes of many people. So a lot of other ICBs are actually interested in it. So whether they're going to actually deliver the service within their areas is something that is unknown to me, but it's not impossible at all.
Brilliant. And just in a way of a recapping, for those who are in the Kent and the Medway area, if they see the bus, what opportunities have they got in terms of what can be tested for them, real quick, while they jump on the bus?
We can check their body mass index, which involves your height and weight. We can check your blood pressure. We can do a random blood glucose if you're eligible. So as long as you don't already have a diagnosis of diabetes, or if you have a family history and you're worried about diabetes and you speak to the nurse and they find that you're eligible, we can do random blood glucose testing. We can signpost people for smoking cessation, signpost them for cancer awareness, and other services that are on the bus.
Brilliant. And just before we wrap up, for someone
And
who
sorry, and I completely forgot also, they can have their COVID vaccination on there as well if they're
right.
eligible.
And just before we wrap up, for someone who might be listening now and thinking, oh, that sounds great. It sounds like something I could do in my lunch break. I just don't know if I could do it today. Is there a deadline for the initiative or have they still got some time?
Well, the current initiative is running up until the 30th of June. I can't speak for after the 30th of June, but the current initiative is running until the 30th of June. So between now and the 30th of June, you can go on the NHS website, and you can actually find where the bus is. And if it's within your area, by all means, hop on the bus and get checked.
Hop on the bus. Thank you so much for your time today, Tonya. It's been lovely speaking with you.
Thank you so much.